really easy case, I think maybe I do not need to say too much. This is EIC, epidermal inclusion cyst, aka infundibular cyst. So just go through it really quick. So we know this is cystic structure, and then we do not see any annexal structure attached to the cyst wall, and then a lot of this stratum corneum material inside. And then there's something I want to say. I don't think we need to say anything about this. Then we have one differential. This is called a bronchogenic cyst. So we also can see this cystic structure, but we also can see the lining of the cyst wall are different. We have this pseudo stratified ciliated wall in cells in the cell wall, and then we also can see some other structure like this, maybe muscle. Then sometimes we may also see cartilage, and also kind of maybe some like salivary gland structure here. So this is the bronchogenic cyst. So just something like in the bronchi structure, but they form a cyst, usually in the also in the midline of the neck. This is another cyst. This is called a Branchial Cleft Cyst. So in low power, we also can see this cystic structure, but the cyst wall lining is kind of different. Even here, we can see this proliferation look like germinal center. So when you make the diagnosis of this branchial cleft cyst, you need to see tons of lymphocytes in the cyst wall and a little bit of the squamous epithelial lining. But just be careful if you can see something like squamous cell carcinoma maybe hidden here. So you still need kind of medium power to check any atypy here. So for this one, really easy, thickened lymphocyte proliferation, and then with this normal looking epidermis, this is branchial cleft cyst. And then I think this one is dermoid cyst. We already know that the difference between epidermal cyst and dermoid cyst, that is, we have this annexal structure, like hair follicle, maybe sebaceous gland. So this is a dermoid cyst. And then I think dermoid cyst usually happen in the face, around the eye. Another cyst. This we call Steatocystoma. And then I think in the head and neck ENT, they also have a KOC, also looks identical. So when you see this cystic structure, you can see it will attach to some annexal structure, including sebaceous gland and hair follicle. But when you see inside, there are not tons of this keratin material inside. And then more characteristic, we can see this, we call this is eosinophilic cuticle, just like a shark tooth cuticle, forming this lining. So this is the feature for this Steatocystoma, like this, shark tooth cuticle eosinophilic material. and then with this annexal structure. Okay, another cyst, also pattern recognition. This cyst look quite different from the previous one because we have this thickening eosinophilic keratin. We call this trichilemmal material or differentiation, really thickened. Then in the stratified squamous epithelium, we can find absence of granular cell layer. So this is a PILAR cyst. Usually happen in the scalp. Why I say this is scalp, because we have this really deep hair follicle go down into the subcutaneous. So we know only in the scalp we have this big hair follicle going down deep. I put two differential here. This one looks really busy, but we can see really well demarcated. If you go high power, you will think it should be something malignant, but it's not. In the derm path, maybe superficial soft tissue parts side now, we usually will estimate whether this is malignant or not based on some criteria, like well demarcated, and then if we cut this lesion into half, they are symmetric. So if we have these two features, usually that should be benign, but we still need to see the cytology. There should be some area just like mimicking the PILAR cyst, because this is the cholesterol. Like this material, just like the PILAR cyst, trichilemmal differentiation stuff, and then this cell, you could not see really polymorphic epithelial lying like this. You may occasionally see mitosis, but it doesn't matter. And then this whole lesion just look like really similar. Every area you cannot see really highly polymorphic cell, and then even necrosis here. So this is called a proliferation trichilemmoma, or maybe proliferation PILAR cyst. This is another one, proliferation trichilemmoma or proliferation PILAR cyst. They look the same, really well circumscribed, and then they have some material mimicking the PILAR cyst, like this area, really eosinophilic dense keratin. Then when you look around, see the cytotic feature do not make you worrisome, and then they don't have like infiltrate growth pattern. They are really well circumscribed. But you can think about that if you have something big in your scalp, definitely you will try to take it out.